Good morning. Our topic for discussion today is about single complete denture. So this is a photograph of a completely edentulous maxillary arch, which has an opposing natural teeth, and a completely edentulous mandibular arch with opposing natural teeth. So usually single complete dentures can oppose a natural teeth or an RPD or a tooth supported over denture or an implant supported denture. So this is the picture showing a complete denture which is opposed by an RPD. The second picture showing opposed by a natural tooth which can be used as an overdenture, and the third one is an implant supported. The definition according to GPT 9 is a single complete denture. It is a process which replaces the lost natural teeth and its associated structures functionally and aesthetically as a single unit which opposes all or some of the natural teeth. So it is most prevalent in mandibular canines and are retained for the longest time, followed by the mandibular incisors. The maxillary single complete dentures opposing the lower natural teeth is a more frequent occurrence. So steps involved in a fabrication of a single complete denture are the diagnosis and treatment planning, the mouth preparation, impressions and jaw relations, teeth selection, balanced setting, try-in, insertion, recall, and maintenance. So coming to the diagnosis and the treatment planning, the edentulous arches are evaluated similar to any of the complete denture fabrication in an edentulous arch, whereas the teeth of the dentulous arch are also evaluated based on the criteria. Why mouth preparations are done? Mouth preparations are usually done to correct the interferences or to remove any supraeruptive tooth or to correct the planes further, so that in further to avoid any complications with relation to the occlusion. So certain techniques are followed for tooth modification. Some of them are the Swenson's technique, the Eustace technique, the Bruce technique. So Swenson's technique is it casts are firstly mounted on the articulators using provisional centric relation at an acceptable vertical dimension. The maxillary record bases made and then the denture teeth are set. If the lower teeth interfere with the placement of the denture teeth, then the stone teeth are adjusted and marked on the cast with a pencil. The natural teeth are modified using the diagnostic cast as a guide. So in Eustace, the next technique they use Eustace occlusal template method. Here they use a metal U-shaped occlusal template. It is placed on the occlusal surface of the remaining teeth and cusps and are adjusted and identified. The stone cast is modified to a more acceptable occlusal relationship and the reduced areas are marked with a pencil. So necessary alterations done on the natural teeth while using this cast. The third technique is the Bruce technique. Here what they do is the lower diagnostic cast is again similarly mounted with the upper and the lower one with the centric relation record. The necessary modifications are made on the stone cast. An acrylic resin template is fabricated on the modified stone cast. Then it is checked in the patient's mouth for interferences and the interferences are removed. The process is repeated until the template seats properly. So now the last technique is the Boucher's method. In this method, what they do is similarly the centriculation is recorded using the occlusal rim and a porcelain tooth are used instead of an acrylic tooth. Since the porcelain tooth are more harder, they will help to grind the tooth and make it into an occlusion. The impressions and the jaw relations. For an edentulous arch, the condition of the residual ridge and the phyllosis of the complete denture impressions are similarly followed here. For the dentulous arch, the impressions are made with the irreversible hydrocolloids after all the occlusal plane corrections are done. Then the vertical dimension of occlusion is also managed. So here if you can see, for an example of an upper completely edentulous situation, an impression is made similar to the conventional technique. Primary impressions made, then a special tray is made, then bottom molding and a wash impression is made, then the occlusal jaw relation is done, and then trial is done and the final denture is inserted. So then coming on to the uh, change in the tooth setting, that is the balanced tooth setting. So in a balanced tooth setting, there are two methods actually. That is the functional chew-in technique and the articulator equilibration technique. The functional chew-in technique is divided into four types. These are done in patients who have a good neuromuscular coordination. So the first technique is the Stansbury technique. In this technique, what they use, they mount the maxillary and the mandibular cast on an articulator in a centric relation to an acceptable vertical dimension. Then They adapt a new base plate and fabricate the occlusal rim made of the impression compound on the edentulous cast. The compound occlusal rim was at least twice the width of the molar teeth and sufficient in height to receive an impression of the central fossa of the lower teeth. This occlusal rim was then heated and placed in the articulator and the impression of the fossa of all the opposing teeth. So that is the Sainsbury technique. So the materials that they use here are the compound and the carding wax. Now coming to the Wicks technique. So Wicks technique is a modified functional chew-in technique, and then it is also an impression technique. Here the anterior teeth are set in chair side. The wax occlusal rims are posterior to the cuspid teeth are removed, that is posterior to the canines are removed. Acrylic resin is added and firmly pressed against the occlusal surface of the teeth on the mandibular cast. When the acrylic sets, the acrylic resin is trimmed so as to leave only a fin of resin falling into the central grooves of the lower posterior teeth to maintain the vertical dimension. So Sharry's technique is again, it is a simple technique of using a maxillary rim of a softened wax. Lateral and protrusive chewing movements are made so that the wax is abraded, generating the final path of the lower cusps. This is continued until the vertical dimension that is to be achieved will be received. Now the Rudd's technique, it is suggests, or rather it is a similar technique to the Stansbury technique, just that they use two maxillary bases. One base is used for recording the generated path and the other is for setting the teeth. So the advantage of this technique is that it decreases the number of appointments necessary for the construction of the denture. And the next technique is the articulator equilibration method. This method is used when the denture bases are not stable and our neuromuscular control of the patient is very poor. The upper and the lower cast in these cases are mounted on a semi-adjustable articulator. The buccal lingual position of the lower teeth and their relation to the upper arch is studied, and the centric or holding cusps of the lower teeth are selected. The upper denture teeth are set in a cusp to fossa relationship. This inclines of the non-centric cusps are reduced to facilitate a balanced occlusion. So when we talk about a single complete denture, there is a phenomenon called as a combination syndrome. What actually happens is combination syndrome has synonyms. It is known as a combination syndrome, or it can also be known as an anterior hyperfunction syndrome, or it is also known as a Kelly syndrome. Right, Edward Kelly in 1972 first noted patients restored in this manner experienced a decrease in the vertical dimension of occlusion and the anterior repositioning of the mandible in addition to bone loss of the maxillary anterior. There are 5 typical features for a combination syndrome, which we will see again. Now, combination syndrome definition, according to the GPT, is it is the characteristic feature that occurs when an edentulous maxilla is opposed by natural mandibular anterior teeth, including the loss of bone from the anterior portion of the maxillary ridge, overgrowth of the tuberosities, papillary hyperplasia of the hard palatal mucosa, extrusion of the lower anterior teeth, and loss of alveolar bone and ridge height beneath the mandibular removable dental prosthesis. So as I told earlier, combination syndrome has 5 features. The 5 features being they are known as the 5 cardinal features. The first feature is bone loss in the anterior maxilla. So the maxillary anterior region, there will be resorption of the bone, which is going to be replaced by flabby tissues. The second finding is the downgrowth of the tuberosity. The third one is the papillary hyperplasia of the hard palate. And the fourth one is what? Supra-eruption of the lower anterior teeth. The fifth one is bone loss under the lower distal extension removable prosthesis. Thank you.